Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Hannah Recht, a reporter at Kaiser Health News, about her recent story about the government's COVID-19 Test to Treat program, a new way to get antivirals to eligible patients while they would still be effective, and why it isn't working exactly as intended. This interview was recorded on April 20th. Let's listen.
Hannah Recht, thanks so much for joining me.
Yeah, thank you for having me.
I really want to talk to you about your recent article in Kaiser Health News about the federal Test to Treat program. So I understand it was meant to reduce hospitalizations and deaths by getting antivirals to people who test positive quickly. And I'm curious if you could tell us a little more about the program and how it's supposed to work.
Yeah, the Test to Treat program, just like you said, is meant to help people who have COVID or think they may have COVID and haven't gotten tested yet to get that testing, get that treatment, and get antiviral pills in their hands if they qualify for them as quickly as possible. There are two different antiviral pills on the market now called Paxlovid and Lagevrio, also known as Molnupiravir, and both of them are designed to be started within 5 days of someone's first symptoms. So you start having symptoms, you get a COVID test, it could be a couple days there already. And by the time you find out you're positive, to actually get an appointment with your regular doctor, if you have one, and to get a prescription for those pills and to get to the pharmacy to pick them up, to try and have to figure out where they're in stock, that's a really difficult process that can take a long time. And so the Test to Treat program was designed by the Department of Health and Human Services to try and combat that issue, to make it a little simpler to get these treatments. And so it's designed for people to be able to go in one visit, a sort of one-stop shop, to get tested for COVID if they haven't been already, get rapid results, and then pretty immediately go into an appointment with a doctor, a nurse practitioner, another medical provider who can assess them, see if they qualify for one of these antiviral pills. So, for example, if they're older, if they have a chronic illness or some other things that put them at higher risk for COVID complications, they may be eligible. They see, do you have any medication interactions or other conditions like severe kidney disease that would potentially not make you a candidate for these medications? But if you are appropriate, then they can write a prescription and you can pick them up at an in-store pharmacy. So that's the goal of the Test to Treat program. When it works very, very well. But unfortunately, what we found is that in a lot of cases, in a lot of parts of the country and certain providers, it's just not really working the way that it was designed to.
So what did you find?
Yeah, so we found that in many parts of the country, large swaths of the country, especially rural areas and smaller cities, there just aren't any of these Test to Treat providers yet. This program was announced about a month and a half ago, and the Department of Health and Human Services launched a map for this on March 30th, where you can look up your location and it shows Test to Treat providers near you. There's also a call center for people who don't have internet to get that information. And unfortunately, there's large swaths of the country that just do not have any of these providers. So it could be a 1, 2, even 3 or more hour drive to get to one of them. So that's a problem right there. If there's no locations near you, how are you supposed to know where to go? And the other problem that we found is that the program is dominated by CVS Minute clinics. They make up more than half of the locations nationally. But we found some really severe problems in actually getting an appointment there. It's very, very, very difficult to book online due to a number of technical problems. And then we found in person that they didn't necessarily always have the antiviral pills in stock or same-day appointments available. So, even if you're in a big metro area like the District of Columbia, where I am, and have a bunch of options near you, it may be difficult to access.
Is it because they're short of medication? Is that part of the problem?
When these pills first rolled out, it's been a few months now, there were absolutely shortages. There just wasn't a lot of supply. But these days, there is more supply. Like any medication, it may be on hand one day at the pharmacy, the next day it's not. It's sort of a little bit unpredictable of when they might get these shipments in. So actually, when the CVSs that my colleague Rachana Pradhan visited here in Northern Virginia, they didn't have the pills in stock, but when she went back 2 days later, they did. So availability is not the biggest issue right now. I think it's connecting people with information and making sure that there are providers set up to do this all across the country.
It seems hard enough to get people in for a test early enough. And yet now there's this added part where if you need this treatment, you may not be able to access it in a timely fashion.
Yeah, absolutely. And that's what the Test or Treat program was designed to do, was to make it this one-stop shop visit. We know that before the pandemic, according to federal data, just about a quarter of Americans didn't have a regular source of medical care, like a primary care doctor. They didn't have a person who knows them, knows their medical history, that they could sort of call on the phone and talk about that. We hear a lot the past 2 years, call your doctor and ask if you should wear a mask, call your doctor and ask about COVID treatment, call your doctor and ask about if you should get vaccinated. So many Americans don't have a doctor, and the rates are even higher for Black and Hispanic Americans and Americans in certain parts of the country. So that's where this program comes in. Another thing I will add is that even if your regular urgent care center, for example, is not listed on the Test to Treat map, they might be offering these services. And that's another sort of wrinkle here, is that in some places there are options. It's just finding out about them is what's difficult. And one person that I spoke to is Dr. Kirsten Bivens-Domingo. She's the chair of the Department of Epidemiology and Biostatistics at the University of California in San Francisco. And she's also a practicing physician at San Francisco General Hospital. And she told me that they are basically doing all the steps of the Test or Treat program. They're testing patients for COVID. They're prescribing them antivirals when appropriate. And they're actually delivering medications. They're driving these drugs over to patients' houses, really doing all steps of the process. But they're not listed on this federal Test to Treat locator map. They're not listed on the state or local health departments' websites either as of last week. So if you're in San Francisco, how are you supposed to know that San Francisco General is an option for Test to Treat if it's not listed anywhere? So there are places out there who are doing all parts of this process, but getting information out has seemed to be a real struggle for HHS at this point, and for state and local departments, many of which are linking to this federal map and not sort of writing their own list of here's where to go locally.
Mm-hmm. And does the fact that we're seeing fewer mass testing sites, does that have an impact on this process?
That's a good question. In most cases, those testing sites were not doing COVID treatment. And that's, again, part of what this is designed to help with, is that the testing site isn't necessarily set up to write prescriptions for these antivirals. So I don't know that it's having a huge impact on this part of the COVID treatment, but in terms of knowing how many people have COVID out there, in terms of knowing where antivirals are needed most, it certainly gives us a narrower window into what's actually happening in the pandemic in general, and making sure that people can afford COVID testing, since the federal government is no longer reimbursing for COVID tests for people who are uninsured. And many of those local and state health department run sites are the best option for people who are uninsured or underinsured to get free COVID testing.
I was going to ask you about cost. Obviously, it seems like you need to have some tech savvy to get places and figure this out. And I'm wondering if cost is also an issue.
It absolutely is. Now, there are some free and low-cost providers that are participating in the Test to Treat program. If cost is an issue for you, I would absolutely encourage you to look up your local community health center if there's a place that you already get lower free cost care. Some of those are participating in the program, or can write a prescription and send it to your local pharmacy, even if they don't have the pharmacy on site that would allow them to be part of the Test to Treat program. So there are about 200 federally qualified health centers, which are these federally supported community health centers that treat uninsured people, especially that are participating in the program. There are also some Indian Health Service clinics, as well as military clinics. But again, the majority of them are for-profit chains like CVS, Walgreens, and Kroger, and they do charge for the appointments to be considered for an antiviral pill. The pills themselves are paid for by the federal government. You shouldn't have to pay to fill a prescription, but in order to get assessed by a doctor or a nurse practitioner, there is a fee. And so CVS, which runs about 1,200 of these sites, they can charge about $100 or more for these appointments, whether you're doing it in person or via telehealth. And that can be a real barrier for people whose insurance doesn't cover those clinics or who don't have insurance at all.
Mm-hmm. So it seems as though there are just layers of barriers here. Do you have any thoughts on how this could be solved?
Yeah, absolutely. I think we're seeing a couple solutions already in a few parts of the country. A couple local health departments, including New York City, Los Angeles County, Erie County, New York, have unveiled their own city or county-run test-to-treat programs. So in some cases, those are conducted entirely via telehealth, where you do a phone call or a video visit with a county-provided practitioner, and they would assess you for treatments and then either send a prescription to your local pharmacy or deliver it. And in those cases, the care should be low cost or free for local residents. There are also a couple telehealth options available that generally do cost less than CVS's offerings, for example. One of them, which I discussed in the story, is run by a company called TruePill, and you can find that at findcovidcare.com. They offer COVID treatment appointments for between $25 and $55. They don't accept insurance, but again, that cost is comparable to what you might pay in a copay going to CVS, for example. So if you don't have insurance, or if your insurance isn't covering other options nearby, telehealth may be a good option for you, a cheaper option.
So I guess my last question really is, it seems to me as though there are these barriers and they're working on them, and hopefully they'll iron them out. But at the same time, not a lot of people know about Test to Treat. Are there efforts in motion to sort of get the word out?
Yeah, absolutely. The Department of Health and Human Services has created some social media campaigns, and certain state and local health departments have done the same. Unfortunately, a lot of the large pharmacy chains that are dominating the program are not really advertising these as well as they could. When you go to CVS's website, it's really difficult to find the information on Test to Treat. There's no one web page that explains what is the Test to Treat program. Here's how to get an appointment. Here's what it costs. Here's what it entails. That information is not centralized. So I think there's a lot more that can be done by these federal partners who are really running the program on the ground. And there's a lot more that certain state and local health departments could do to get the word out and to make sure that residents of those areas know where they can get treatment.
Hannah Recht, thanks so much for joining me.
Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.